1 in 3 people will get cancer at some point in their lives. Did you know that? The concerning part, though, comes next. Simply because the early warning symptoms were missed, millions of cancer cases are detected too late each year. The American Cancer Society states that over 90% of cancer cases can be successfully treated if they are discovered early. However, survival rates can drop to less than 20% if the diagnosis is postponed until the cancer has progressed. I'm going to share 8 subtle warning signs that your body may be giving you in the next few minutes. Although these indicators are simple to overlook, they have the potential to save your life. These symptoms are not your usual, well-known ones. Medical science supports these silent indicators, and many people have detected cancer early by heeding them when treatment was still very successful. Now, I know what you're thinking. These days, it feels like every little backache or wave of fatigue gets blamed on cancer, thanks to something we read online. But don't worry. This video isn't here to cause unnecessary panic. We'll be focusing strictly on warning signs that are scientifically verified by medical experts, not internet myths or rumors. The information you're about to hear could make the difference between catching a deadly disease early or missing it completely. One often overlooked symptom that could point to cancer is persistent, unexplained bone pain. Unlike muscle soreness from working out or minor injuries that typically fade within days, bone cancer pain tends to worsen over time and often becomes more intense at night. When cancer grows inside the bone, or when it spreads, also known as metastasis, to the bones from another part of the body, it alters the structure of the bone tissue. This causes a deep, aching pain that simply doesn't go away. The most common type of bone cancer is osteosarcoma, which typically affects long bones like those in the arms and legs. At first, the pain might feel similar to a minor sprain or muscle strain. But over time, it becomes constant and harder to ignore. Some patients describe the sensation as a deep, relentless ache, even after taking over-the-counter painkillers. If this pain is accompanied by swelling, tenderness, or even sudden fractures in the bone, it's critical to get it checked out. These aren't just random aches. They could be your body's way of signaling a serious internal issue. Catching it early can drastically improve treatment outcomes and prevent serious complications down the line. Your eyes are not just the windows to your soul. They can also reveal important clues about your overall health, and in rare cases, even early signs of cancer. One example is ocular melanoma, which is the most common eye cancer in adults. The early symptoms of this cancer are extremely subtle, so subtle that they're often mistaken for ordinary vision problems. Signs to watch for include blurry vision that doesn't improve even after getting new glasses, flashes of light, or the appearance of a dark spot on the iris, the colored part of your eye. This is especially important if that spot changes in size or color over time. People with lighter colored eyes or fair skin are at a higher risk of developing ocular melanoma. Advanced imaging tools like digital retinal scans can help doctors detect hidden issues inside the eye before major symptoms even appear. That's why it's important not to ignore persistent eye pain or unexplained vision changes. Early detection could save not just your eyesight, but potentially your life. Regular eye exams are crucial, particularly if you're frequently exposed to sunlight or have a family history of eye cancer. When it comes to skin changes, not all rashes are harmless. Some may look innocent, but, in reality, can be a serious red flag that requires immediate medical attention. One such example is skin symptoms caused by leukemia, a cancer of the blood-forming tissues in the body. Petechia are tiny, spherical skin lesions that can be caused by leukemia. Low platelet counts, which are necessary for blood clotting, are the cause of these. Tiny blood vessels called capillaries may leak as platelet counts fall, producing tiny red, purple, or brown spots beneath the skin. They typically show up where pressure is applied, such as under tight garments or around the ankles. Leukemia petechia are typically persistent and non-itchy, in contrast to normal rashes that are itchy and go away on their own. These spots often don't fade when you press on them, which is a key way to distinguish them from more benign skin issues. If these dots are accompanied by other symptoms such as easy bruising or unexplained bleeding, don't ignore them. It could be your body's way of warning you that something serious is going on. Another often overlooked warning sign is a dark vertical stripe under your fingernail or toenail. This could be subungual melanoma, a rare but dangerous form of skin cancer that develops beneath the nail. It usually starts as a thin dark band running along the length of the nail. This condition is known medically as melanoma striata. What makes it different from normal nail pigmentation is that it appears suddenly, often grows whiter over time, and can have an uneven color or blurry edges. The thumbs and big toes are the most commonly affected nails, but it can happen on any nail. Many people mistake this for a bruise, fungal infection, or minor injury and delay seeking medical help. The presence of numerous colors or fuzzy borders, a stripe wider than 3 mm, and pigment that spreads to the surrounding skin, also referred to as Hutchinson's sign, or warning signals. See a dermatologist right away if you experience pain, nail cracking, or bleeding as well. When it comes to this deadly cancer, early detection is crucial. If you often wake up drenched in sweat, even when the room is cool and your blanket is light, it might be more than just your thermostat. While night sweats can be triggered by menopause, anxiety, or certain medications, persistent and unexplained night sweats may be an early warning sign of lymphoma, a cancer of the lymphatic system. It's important to distinguish between ordinary night sweats and those associated with cancer. In lymphoma cases, sweating is often paired with what doctors refer to as B symptoms, which include fever, unexplained weight loss, and intense fatigue. These symptoms suggest the cancer is affecting your immune system and causing inflammation. When cancer cells are present, your immune system releases inflammatory chemicals that interfere with your body's temperature regulation. Lymphoma also disrupts the normal function of the lymphatic system, which helps fight infections and regulate body fluids. Occasional sweating isn't cause for alarm. But if you're waking up soaked night after night, as if you've just stepped out of the shower, it's a serious red flag that should not be ignored. Chronic heartburn, also known as GERD or gastroesophageal reflux disease, might seem like a minor inconvenience. But if it doesn't improve with lifestyle changes or over-the-counter medications, it could be an early sign of esophageal cancer. Unlike occasional reflux, heartburn linked to cancer tends to resist standard treatments and becomes more persistent. Constant acid exposure over time damages the lining of the esophagus. This ongoing irritation can lead to a condition known as Barrett's esophagus, where the normal cells begin to change, a stage that is considered precancerous. If you experience additional symptoms like difficulty swallowing, food getting stuck in your throat, or unexplained weight loss along with persistent heartburn, don't delay medical evaluation. If antacids haven't helped after 3 weeks, it's time to see a specialist. A proper diagnosis could make all the difference. Don't dismiss it if your skin or the whites of your eyes become yellow all of a sudden. It is a typical symptom of jaundice, which is brought on by an accumulation of the pigment bilirubin in the blood. Although there are numerous possible reasons of jaundice, its abrupt onset in adults may indicate the presence of liver or pancreatic cancer. In pancreatic cancer, tumors can block the bile duct, which causes bile to back up and leak into the bloodstream, giving the skin and eyes a yellowish tint. It often starts subtly but worsens over time as the disease progresses. Because the pancreas is located deep within the abdomen, early symptoms are easy to miss, making visible signs like jaundice even more critical to recognize. If yellowing skin appears alongside upper abdominal pain, dark urine, or pale-colored stools, these are additional signs that something serious may be occurring. These symptoms are your body's way of asking for help, don't ignore them. If you've been running a low-grade fever for weeks or keep getting fevers without a clear cause, this could be your body's response to cancer cells, particularly in blood cancers such as leukemia or lymphoma. Unlike fevers caused by infections, which usually resolve within a few days, cancer-related fevers tend to be persistent, cyclical, and resistant to typical treatments. In cancers like leukemia, the immune system is constantly on alert, releasing inflammatory molecules called cytokines. These chemicals keep your body temperature elevated and can result in frequent fevers that seem to come and go without explanation. These fevers are often accompanied by other symptoms such as night sweats, rapid weight loss, and extreme fatigue. Some people also experience specific fever patterns, particularly in cases involving blood cancers. If your fever is over 100.4 degrees Fahrenheit, 38 degrees Celsius, and lasts more than 2 weeks, or keeps coming back without any obvious reason, it's important to see a doctor. Blood tests can detect cellular abnormalities and other red flags associated with conditions like leukemia or lymphoma. While not every fever points to cancer. Persistent fevers without explanation should never be brushed aside. Early detection could be the difference between life and death. Thanks for watching. If you found this video helpful, hit that like button and share it with someone who needs to see it. And of course, don't forget to subscribe so you never miss out on more life-saving health tips and science-backed content.